Have you ever wondered how your doctor decides on what drugs to use or what combination of drugs to use for a particular disease? Have you wondered how a doctor could decide to change your immune system to prevent more serious disease? Let me take you on a short journey. Johann Meyer, a dentist, presented to me with severe pain and swelling of his joints, especially his wrist, ankles, and knees were swollen. He felt fatigued, and he was a worried man because he wasn't sure how this would influence his life as a dentist. I diagnosed him with rheumatoid arthritis and started conventional therapy for this condition. Rheumatoid arthritis is the most common form of inflammatory arthritis. There are more than 100 types of arthritis. Rheumatoid arthritis is the most destructive of these. It's an autoimmune disease, which means that the body's own immune cells start attacking tissue in the own joints and the tendons. This treatment can lead to distraction and disability. It is very important to give the right medication at the right time. Now, the culprits of the immune system are the T lymphocytes or T cells and the macrophages. They produce substances to speak to each other to control the immune response, and especially tumor necrosis factor alpha and interleukin-6, which are the cytokines that are mainly responsible for the damage that we see on the cartilage, on the bone. On X-ray, this shows as narrowing of the joint space, and we see punched out lesions at the end of the bones in the joint. And this is what results in loss of function and disability. Johann Meyer did all the right things. He followed a good diet, he slept enough, and he used the right medication. He used chloroquine, sulfasalazine, methotrexate, the drugs that we usually give for rheumatoid arthritis. But he could not tolerate the methotrexate. It caused more worsening fatigue and also nausea. And on chloroquine and sulfasalazine alone, his disease was not controlled. So I needed to treat him with repeated injections of steroids into his joints. And then he developed side effects. And the fear of not being able to continue his career as a dentist became very real again. Let me introduce you to Suzette Riedel. She's a lecturer at the university. Her life changed overnight. In 2010, one morning, she could not get out of bed. She could not get to the toilet. She felt as if she was strapped in a straitjacket. When I saw her, I realized that she had a very aggressive form of rheumatoid arthritis, as also shown by her blood test, which showed high levels of the autoimmune antibodies that we see in rheumatoid arthritis, including the rheumatoid factor and the anti-CCP. A marker of inflammation, the C-reactive protein or CRP, which normally is 5, was in her case elevated to 138 milligrams per liter. At the time, we were doing studies on novel new drugs called biologic disease-modifying drugs. And one of these drugs is tocilizumab. It's a monoclonal antibody responsive against interleukin-6 receptors. In this study, patients were randomized to 4 different treatment arms, either the standard treatment, methotrexate, or 2 different doses of tocilizumab in combination with methotrexate, or higher dose tocilizumab on its own. We found that the tocilizumab methotrexate combination was the best that we could offer patients. But combination of methotrexate with tocilizumab was not the only option. Tocilizumab on its own was also effective and significantly better than methotrexate on its own. Suzette did very well on this study. 2 days after first infusion of study drug, she already felt much better. And at 4 weeks, she felt almost normal. Her CRP, which had been 138, came down to less than 10. She's still on biologic medication now, and she still teaches. What about Dr. Meyer? He could not be enrolled into the function study because he already had established disease. Fortunately, we were able to offer him another clinical trial called the SUMMACTA study. In the SUMMACTA study, we tested 2 different formulations of tocilizumab. One that is given intravenously into the blood vessel as an infusion, monthly intervals, or an injection under the skin, subcutaneous tocilizumab given at weekly intervals. And in the SUMMACTA study, we demonstrated that the under-the-skin injection of tocilizumab was as effective as the intravenous injections. And both of these are now provided as treatment and are registered in South Africa for the use in rheumatoid arthritis. Johann also did very well on this study. He has continued on this drug, tocilizumab, until now. I phoned him last Sunday to inquire how he was. He said his arthritis is perfect, he's still working as a dentist, he still cycles, but unfortunately he had mildly symptomatic COVID disease. Christo Augustijn, my age, pharmacist, he was admitted with a pneumonia to a hospital end of last year, was found to have COVID pneumonia. His disease was rapidly progressive. He thought he would die. He needed high-flow nasal oxygen in the ICU, and his condition only turned around when he received tocilizumab, the anti-rheumatic drug. How can that work? The SARS-CoV-2 virus does elicit an immune response, which also involves the T lymphocytes and the macrophages in the lung. And these macrophages also produce high levels of interleukin-6. We call it a cytokine storm. It's a hyperimmune reaction with interleukin-6 being, again, a culprit in this very severe cytokine reaction. By providing tocilizumab, we could show in the IMPACTA study that this treatment in fact prevents the progression in patients who are not requiring a ventilator to not becoming a person on a ventilator. But my friend and patient almost died. There must be a better way to combat COVID-19, and there is. It's the ultimate form of immunomodulation for this condition, what we call vaccination. In the ENSEMBLE randomized controlled trial, the candidate vaccine, which we now know as the Johnson & Johnson jab, was shown to be highly effective in preventing COVID-19 and specifically effective in preventing serious disease, hospitalization, and death. I changed from being an investigator to participate as a participant in the ENSEMBLE study. We now know how effective this form of immunomodulation is. On the 6th of September, at Groote Hospital, there were 156 patients with COVID-19. 153 unvaccinated, 3 vaccinated. Of the 66 patients in high care units in ICU, all 66 unvaccinated. Of the 32 patients on ventilators, all 32 unvaccinated. If you have not had the opportunity to be vaccinated, your opportunity is now.